Have you wondered why some people are always having this frequent feeling of thirst, urinates frequently, get tired every now and then, and also have the frequent feeling of hungerness, that is, they feel hungry at all time. This can actually be attributed to a condition known as a diabetes mellitus, and this is a very serious medical condition. And the surprising thing with is that people with this condition don't even know that they have it. So in today's video, I'll be talking about diabetes mellitus, the different types, the signs and symptoms, the prevention, the complications, and everything you need to know about this condition. So stay tuned. Let's get started. Now, what is diabetes mellitus? Diabetes mellitus is a condition. It is a metabolic condition that occurs when your blood glucose level is higher than normal. This simply means that it is a condition that occurs when the glucose in the bloodstream, when the sugar in your bloodstream is actually higher or abnormal. That is when it is higher than what it should be, and as a result of this, it might actually cause a problem to the body, or it can, which is the diabetes we are talking about. So before we start, I would like to take us back to knowing what an insulin is, because it is very important in discussing this topic. But before then, I believe that we all know that whenever we take carbohydrates, it's being broken down into glucose, right? And then this glucose are taken to the bloodstream, and then from the bloodstream they are being distributed to the body, to the different body parts that needs it for a proper functioning. And then this is where the insulin comes in, and insulin is a hormone that is being produced by the pancreas, and it serves as a help in transporting this glucose in the bloodstream to the different parts of the body that needs it for a proper functioning. Now, in cases where there is maybe non-production of insulin, insufficient production of insulin, or the resistance of these body parts to the insulin being produced, they might actually cause a problem known as a diabetes. Now, let's talk about the different types of diabetes that we have. Here we have the type 1 diabetes, we have type 2 diabetes, and then the gestational diabetes. Talking about the type 1 diabetes, this develops as a result of the autoimmune problem, that is the problem with the autoimmune system. And then we all know that the autoimmune system are the systems that helps our body to fight against foreign organs, to fight against diseases, and then all of that. So what happens here is that this our immune system begins to see the insulin as and foreign organs. It begins to see them as a foreigner, as an invaders, then thereby destroying them, or destroying the cells producing this insulin, and then thereby leading to either insufficient production of this insulin or non-production of the insulin at all. And then it is important to know that as a result of this, people with this kind of insulin would need insulin to for survival. They are the people called the insulin dependent, and this occurs in both children and then adults. Now let's move over to the type 2 type of diabetes. This is the most common type of diabetes, and then it is caused as a result of our body being resistant to the insulin produced. So what happens here is that there is production of insulin, right? The insulin is there, but our body does not make use of it as it should. I mean, the insulin itself does not function properly to help in distributing the glucose and the sugar to the parts of the body that needs it. There is ineffective use of this insulin by the body, and then there is also other factors that are contributing to this type 2 diabetes. Here we have the family history. This is where maybe any member of a family has a diabetes or has this type 2 diabetes, so it is more likely that another person from the same family will develop this type of diabetes. Then we have other factors such as genetics. We have something like overweight, and then so on and so forth. Now, it is important to know that Most people with this type of type 2 diabetes does not manifest any signs and symptoms. So this is why it is very important, very recommendable to always be on the check, to always stay in check with your glucose level, especially if you are at risk of developing this type of diabetes. Now let's talk about the gestational diabetes. This is the type that occurs during pregnancy and someone who does not previously has the diabetes. That is, it occurs as a result of the pregnancy, and then in most cases after delivery it goes off, but not same with all mothers. So mothers actually develop type 2 diabetes from this type of gestational diabetes. That is after it might has dissolved, and from then they will develop type 2 diabetes. Now let's move over to the signs and symptoms of this diabetes. What are the signs and symptoms you would see, and then you will begin to suspect this is a diabetes? This is where we have the 3P, where we have the polyuria, the polydyspia, and the polyphagia. Talking about the polyuria, this is frequent urination. The person is urinating so frequently. Now you have polyphagia. This patient is having frequent of hungerness. This patient is always feeling hungry. And then you have polydyspia. This patient is always having this frequent feeling of thirst. And then we also have other signs and symptoms such as unexplained weight loss, blurred vision, profuse sweating, this tingling sensation in the hand or the feet, or the burning sensation in the hands and feet. And also there might be wounds that takes time to heal up. Now let's talk about the diagnosis of this condition. How can it be diagnosed? Actually it can be diagnosed, it can be identified by through several blood tests. Here we have the fasting blood sugar, the random blood sugar, the OGTT, which is the oral glucose tolerance test, and then the HbA1c testing. Then talking about the fasting blood sugar, this is the type that is done early in the morning before the patient must have taken anything by mouth, and then the normal range for this is 3.9 to 5.5 millimole. That is 70 to 99 milligram deciliter. Now let's talk about the random blood sugar. The random blood sugar is the type that can be done at any time of the day, whether in the morning, in the night, or in the evening. It doesn't matter if the patient has eaten or not. Now and then it is considered abnormal if the value gets to 11.1, that is greater than or up to 200, that is greater than or up to 200 milligram deciliter, and then the normal range is from 70 to 140 milligram deciliter. Now let's talk about the oral glucose tolerance test. This is the type that is done before and after a glucose containing drink is given to a patient. This is where the sugar level is being monitored before and after you have given this patient a drink containing glucose to take, in order to compare the sugar level and then make a diagnosis if this patient is diabetic or not. Now we have something called the HbA1c. This is a testing that is done in order to ascertain the average glucose level for the past 2 to 3 months. Now let's talk about the complications of this condition. What are the complications? It has complications to the different parts of the body, including the heart, the kidneys, the eyes, the nerves, and then the foot. Now talking about the complications of the eye, it can actually result to blurred vision, and in more severe cases it can cause permanent blindness. Then talking about complications to the heart, it can increase the risk of heart attacks and then stroke. Complications to the kidney, it causes kidney damages, and then so on and so forth. Talking about damages to the nails, this is where we have maybe something like the numbing or the tightening in both hands and then the foot. Then talking about damages to the foot, you have something like the wound or leg ulcers. So these are all complications of diabetes mellitus. So the body part. Now let's talk about the treatment for this condition. Actually, the treatment depends on the types. Here we have the type 1 and then the type 2. So talking about the type 1, we have something called the insulin injection. This means that people with this type would have to depend permanently on insulin injection, and this is why they are called the insulin dependent. Then talking about the type 2, this is where we have changes in some certain lifestyle that can help treat this condition. This is where we have working on your weight, that is maintaining a healthy weight, eating balanced diet, using insulin when necessary. You will have to be on a regular glucose check, and then so on and so forth. Also, there are medications, all these diabetes medication, which such as metformin and glucophage, which can use to treat diabetes. Now let's talk about the prevention of this condition. Actually, the type 1 cannot be prevented, as it is caused by a problem with the immune system, but there are some certain guidelines that can help prevent the risk of having type 2 diabetes. And this is where we have a maintenance, your body weight, eating balanced diet, quitting smoking, quitting excessive use of alcohol, regular check of the sugar level, and so on and so forth. Now let's talk about a condition known as the pre-diabetes. The pre-diabetes is also a condition that occurs when your blood sugar level is high, but not to the extent that it can be diagnosed or it can be said to be diabetes. Now let's also talk about what is called the hypoglycemia. This is the opposite of hyperglycemia. So this is a condition whereby your blood sugar level is lower than the normal. This is where it is lower than 3.9 millimole. That is when it is below 30 milligram deciliter. Now let's talk about this misconceptions and misbelief about this condition. Number one is that many people believe that eating sugar directly would actually cause diabetes, but that's not exactly what happens. What happens is that remember that type 1 is often caused by autoimmune problem, right? And then type 2 is caused by resistance of the body to the insulin, and then some other factors including the genetics, family history, overweight, and then so on and so forth. Now what this intake of sugar directly would actually do is to increase the calorie intakes and then increase weight gain, which will in turn increase the risk of having type 2 diabetes. So it does not actually cause diabetes itself, rather it increases the chance of having diabetes. Another misbelief about this topic is that people often think that diabetes affects people who are overweight, but it is not always right. Diabetes affects people of different body sizes, people of different body structures, both genders, both adults and children. So I hope you get that into your score. And then others believe that people with diabetes does not eat sugary things, they don't eat sugar, but that is not always true too. They do eat sugar, but only in a moderate quantity, as prescribed by your doctor and depending on your treatment plan. And then most people feel that once I am fine, I don't have diabetes. Once I am not manifesting any symptoms, any signs, I am free from diabetes. But do not forget that there are people with type 2 types of diabetes that does not obviously show the symptoms of diabetes. So it is very important that as a person with high risk of developing this diabetes, especially when you have a family member that has any of this type of diabetes, you should keep yourself in check, including checking for your blood pressure, your eyes, your nails, your fruits, your kidneys, and your heart, to ensure that you are in good health condition. Now, in conclusion, I would say that diabetes is a chronic health issue that can be managed efficiently and then properly controlled if only being diagnosed is early. And then following maintaining a healthy weight, quitting smoking, taking your prescribed drugs, and then engaging in physical activities can actually help prevent serious complications. Also, a proper information with a person with diabetes would actually lead to a healthy and fulfilling lives. So if you know someone battling with diabetes, please share this video to the person. Also, if you find this video interesting, don't forget to like, share and comment. And also don't forget to follow Nursing with Anita for more detailed explained health conditions. And then see you again in my next video. Thanks for your time. Bye.